I'm going to show you a little bit of what I do for an exam when I check for low back issues and kind of what I'm looking for. So the first thing I'm going to do, I actually may not do this first if you come to see me, but one of the things I will do is I'll check your leg length, and we're looking to see about how close the heels are in relationship to each other. And what that means is we can be looking for an actual leg length difference. She may have one leg that's just naturally shorter than the other. She may have broken one at one time and have a leg length change. And when you have that kind of a shift, it can actually create a lot of low back tension and pain. So I'll check for that. I'm going to check to see any tightness in the calves, which her right side is tighter. And what happens with that is if the calves are really tight, those muscles and the fascia that surrounds them, which is like a saran wrap, will actually kind of tighten this way, and that can put a lot of pull all the way through your body, even into low back, mid back, even up into your neck. So that can actually, just tightness that's different from side to side, can create pain in upper regions of the body. So I'll check the hamstrings and the IT band, which basically goes from hip across down by the knee. IT band pain is really common in runners because this band of tissue is such a huge support factor for pelvis, low back, hips, and knees. And then do a couple of orthopedic tests, which is just basically trying to figure out, is it joint, is it muscle, is it ligament, kind of range of motion, how everything moves, looking for asymmetries, trying to figure out what isn't moving right. I'm going to check the spine, obviously, so I'm going to check and see if the alignment feels like it's natural, and if the motion, which I think is more important than just the actual how the bones are stacked. We're looking for how they move with each other to see how all that feels. Move up here, check her ribs, up into the muscles here, and then eventually I'll check the upper back and the neck as well. Go ahead and turn onto your back. And relax your legs. And with low back pain, we're always going to check the hip as well. So we're going to do ranges of motion here, and she pops. And just see how everything kind of moves. Try to check all of that. I might even do some muscle testing. So I might have you hold your leg there, don't let me push it down. Good, relax that. And hold there, don't let me push it down. Good, relax that. Check your feet, how they move. And then a little bit into the quads. I might also check and see how her hip flexor sits, if she has any tenderness in through here, because your hip flexor comes from the low back out through and attaches into the pelvis. So if you get any popping in the front, you can actually be having too tight of a hip flexor, and that can actually pull your low back forward, which can also create pain. And if you watch one of the next segments, I'll show you with the foam roller how you can roll out a lot of the tight muscles.